Go.
3, 2, 1, go. I'm Dr. Christopher Sykerbike. We're doing today a cryoablation of neuroma on the foot on the third intermetatarsal space. Benefits of this procedure: it's done under a local anesthetic. We don't have to go into the hospital. It can be done within the physician's office. It's all done under local anesthesia through a very small incision, much safer for the patient. We're going to find the neuroma first under ultrasound. We locate the ultrasound, under ultrasound here, we locate the neuroma in the third intermetatarsal space. I give it a couple quick squeezes so that we can see it kind of pop over the top of there so we know that we're in the correct spot. We've prepared the area and we've put in a numbing injection. I'm going to make a very small incision directly into the foot. Doing okay up there?
Yes.
Through that incision, I'll take my probe, put it through. We're going to break through with the deep transverse intermetatarsal ligament. And you feel a little pop there, and I can feel where that material is at the bottom. I know I'm in the right space for my neuroma. I free my way through that ligament and remove my probe. This time, I'll again find my area under ultrasound and I'll insert my probe through our incision down through the deep intermetatarsal space. And if you look at my screen there, you can see me kind of moving my probe up and down between that intermetatarsal space, between the heads of the bone, right in front of that neuroma. So we're right. The tip is right on top of that neuroma here. Okay, come back to me. Once we have the location, we'll start our freezing. This is a cryo probe. It gets to negative 16 degrees Celsius. When it forms that, it ends up forming an ice ball underneath the probe area. And you can see I can't remove the probe at this point because it's formed that ice ball over the top. The ice ball is about 2 to 3 millimeters in diameter. So we're right onto the nerve. Benefits of this way, as opposed to open removal of the nerve or killing the nerve through ablation, is that we're not actually cutting the nerve. We're freezing around the nerve and removing the insulation around the nerve where the neuroma is formed. This prevents stump neuromas from occurring. We're going to hold the probe in here for 3 minutes. This is the very exciting part of the procedure where we sit here and wait for 3 minutes. And through there you can see there is very little tissue dissection that we have to do, which means that there will be very little scar tissue, easy to recover from. Recovery period for this, we keep our patients weight bearing in a boot for about 1 week. At that point they can transfer into a shoe and get back to work full time. You're fine to be on it during that part. You're fine to walk on it. Patients are able to return to low impact activity after 1 week and can return to running, jumping, and impact activity between 2 and 4 weeks. Typically takes between 2 and 6 weeks for the neuroma to resolve. It's a very successful procedure as well. We tout about an 80 to 85% success rate, which is similar to open surgical neurectomy. Once again, the benefit of this We don't have to go into the operating room, so that saves money over having to go through insurance, to go through anesthesia and through hospital costs. We're able to do everything within the office with very little downtime. And we also are preventing that recurrence of stump neuroma, which occurs in about 20% of patients, according to the literature. 3 minutes we released. I'm going to take my probe out. We're going to let that thaw for about 30 seconds, and then we will reintroduce it and do another freezing. Afterwards, we'll end up putting a bandage over the top here with a little antibiotic ointment. There's no stitches that are needed, no stitches that need to be removed. We typically do follow-up at 2 weeks and 6 weeks post-operatively. Most patients are back to that full activity by that 6-week period. If you're having pain, problems, questions about neuroma, feel free to contact our clinic, AZ Choice Foot and Ankle, at 480-632-5757, or visit us on the web at www.azchoicefa.com.